Good evening. My name is Suzy Smith. I'm an occupational therapist at Lift Therapy. I've been a West Tennessee healthcare employee for 16 years, and I specialize in wrist, elbow, and hand injuries as well as neurological diseases. I got my education. I have a bachelor's degree in occupational therapy from the University of Tennessee at Memphis, and I've worked here ever since I graduated from college. Today, what I wanted to talk to you about is some cumulative trauma disorders of the arm and hand and how to prevent these disorders in your workplace. But before I get started, I want to talk to you about occupational therapy. This is actually Occupational Therapy Month, so I thought I'd take this opportunity to just kind of explain what I do as a profession. Occupational therapy encompasses many different areas of people's lives. So technically, it is defined as a therapeutic use of work, self-care, and play to increase development and prevent disabilities. So this can include adapting a task to help people achieve their maximum independence and enhance their quality of life. That being said, that sounds pretty technical and hard to understand, but we look at the word occupation. And when people think of occupation, they think of just what you do at work. But actually, occupation defines the way that we occupy our time. So that can be self-care, that can be work, that can be leisure. So we're looking at how we spend our time, whether it's paid or unpaid, restful or fun, whether it's an obligation or a choice, and that which fulfills us and gives us purpose and allows us to interact with our environment and function in the world around us. So we have people from all different parts of life. It could be an illness or an injury at birth, or it can happen later in your life. But if any of these occupational areas are impaired, as an occupational therapist, my job is to provide intervention to help them regain function in whatever areas that they're having trouble in. So common things that we treat as occupational therapists are wrist and hand injuries, shoulder injuries. Somebody that have had a stroke will come to us because they might not can use one of their arms, and we'll teach them how to reuse that or how to adapt their everyday living skills so that they can take care of themselves and not depend on somebody the rest of their life. As you see here, what I'm going to talk about today is a pretty complicated topic. The wrist and hand is probably one of the most complicated parts of the body. We have numerous muscles, tendons, and nerves and joints that encompass the elbow, wrist, and hand. So the things that I'm covering today are just the main things that we see in the clinic. There are tons of other things that you can have problems with in your wrist, elbow, and hand, but I'm just going to cover the most common ones today. I wanted to talk today mostly about cumulative trauma disorders, and they're also called repetitive trauma disorders, or CTDs. And these are injuries to your musculoskeletal system, so that can include your muscles, your tendons, your nerves, your ligaments, or your blood vessels. And I personally thought before I studied this a little bit deeper that the largest work-related problem would probably be back injuries, but that's not true. It's actually these repetitive trauma disorders that I'm going to talk about today. So most of the people who report to their doctor with work-related injuries are usually the ones that we're going to discuss in just a minute. So we need to remember that these are not a disease. These are actually a response of our body to excessive or repeated demands without enough time to recover. So if you're doing something over and over and over in the same way every day, day after day, then your body's not going to have time to repair itself. Just normal use of our body, we have some tears, some small tears in our ligaments or our muscles, but our body has time to fix these so that they can get better. But if you're doing it repetitively, you get an accumulation of all these small tears, and as they build up, we start developing symptoms. A lot of jobs have risk factors that can lead to these cumulative trauma disorders, especially those with these here. Repetitive motions, any job that requires forceful pushing, pulling, lifting, and gripping. If you're in an awkward position all day that's unnatural, if you're twisting or turning your body in unnatural ways, if you're holding the same body position for a long time, if you're putting pressure on your soft tissues of your body, like if you're resting your arms on the edge of a desk and it's putting pressure on the soft tissues. That can also cause some trauma disorders. Fast movements of body parts, as in like if a buffer or a housekeeper who's having to dust or use their body parts quickly in their job, they're going to be at risk as well. And the last thing is vibration. So especially construction workers who are using tools that have a lot of vibration to them, they're going to be at risk for these injuries as well. These are the ones I wanted to talk to you about today. These are the most common ones we see at lift therapy. Of course, carpal tunnel, which is probably the most familiar one, wrist tendinitis, decurvains, tenosynovitis, trigger finger, nerve entrapments, and medial and lateral epicondylitis. So we're going to discuss each of these just a little bit. The first thing you're going to notice with any of these is pain and swelling, okay? So when you first start noticing this, that's the time that you need to seek treatment. Because as this progresses and it goes on, you're going to get to a point to where you might have to require surgery or time off of work. So it's important to start treatment as soon as these symptoms start developing. Because after these develop, you're going to start noticing a decrease in your strength and a decrease in your movement, which is going to limit you being able to perform your job. Carpal tunnel is the one we see the most of, and that's basically the compression of a median nerve which runs through the palmar side of your wrist. So as that nerve passes through that tunnel, the median nerve gets pressure put on it because of high force during your job, high repetition, or having your hand in awkward positions and not letting it rest. Common activities that lead to carpal tunnel: typing, which a lot of people do, assembly work, packing, sewing, and cutting. So the symptoms people first notice are at night, because a lot of us sleep with our wrists curled, kind of tucked up under our chin. And when you're in that position, that puts more pressure on the median nerve. And the first thing you're going to notice at night is you're going to wake up with the first 3.5 fingers that are numb. And at first, you can kind of move your hand around and it'll work itself out. But as this continues and isn't treated and doesn't have time to heal, you're going to start developing the pain and the decreased movement and the decreased strength. The next one is a wrist tendinitis, and this can involve any of the tendons that run through your wrist. So basically what happens is the fibers are, again, like we talked about, torn, and then they don't have time to recover, and then you start developing these symptoms. The risk factors are repetition, force, and again the awkward and static postures. So if you overextend your wrist, if you bring it back too far and stay in that position for a long time, that's going to aggravate that muscle group, as well as vibration and fast movements. Decurvains, tenosynovitis, this is actually a disorder that is found in the sheath. The sheath is a membrane that covers your tendon, and it supplies kind of like a synovial fluid so the tendons can glide and that they don't get stuck in the tendon or get stuck in the soft tissue. But if that synovium is injured, then the sheath will not produce the synovium, and therefore the tendons will rub together because they're not lubricated. And that causes a friction between those two tendons, and they start swelling. So you're going to notice that pain in your thumb, and then it's going to start restricting your motion. Jobs with a high rate of decurvains are people who buff or grind, people who sew or cut, packers, and especially housekeepers. Next, we have trigger finger, and this is one we see a whole lot in the clinic as well. And it's also a problem with the tendon sheath. And again, it becomes swollen because it's not being lubricated enough, and the tendon, instead of gliding, it'll kind of catch. So it'll be more of a jerky movement of your fingers, especially when you're trying to straighten them out. So most people can make a fist, but when they try to straighten, it gets stuck down in that position there as if you were pulling a trigger. This becomes very painful after a while, and usually it occurs in the middle and the ring fingers, but we see it a lot in the thumb as well. A lot of these are caused by tools that you use that have hard handles, and it's not protective. So using some tools that have more of a cushioned handle and doesn't have hard edges will help prevent some of this. The pain usually is not severe, but the most aggravating thing is when you go to try to use your hand, it won't open back up once you've closed it. Next, we have nerve entrapments, We don't see these quite as often, but the main one we do see is the cubital tunnel, and that's where your ulnar nerve runs right around your funny bone. So a lot of people who are on a job typing and keep their elbow in a bent position for a long period of time, it starts putting pressure on that nerve, and you get the numbness and tingling in your ring and your small fingers. The other two are pronator teres syndrome, and that's the compression of the medial nerve, and that pain is at the proximal part of your forearm up closer to your elbow on the palmar side. We see a lot of that when you're in carpentry, when you're using hammers or tools. And then the radial tunnel syndrome is, of course, the radial nerve, and it presents like a Charlie horse in your forearm. Medial and lateral epicondylitis, most of us know these as tennis and golfer's elbow. The tennis elbow is the lateral epicondylitis, which is where you're going to have the pain on the outside part of your elbow where the flexor tendons attach. It's caused by rapid overarm motions, just like as if you were hitting a tennis ball with a racket, or any overhand motions. But most of these are job related. A lot of assembly line workers that are doing that same motion over and over, packing boxes or picking up heavy things in external rotation day after day, will start noticing these symptoms. Then we have the golfer's elbow. It's inflammation on the inside of your elbow, and it's caused by forceful rotation of the forearm while you're bending the wrist. So just like the motion you would be in if you were hitting a golf ball, you have that wrist bent, but you're also twisting the forearm at the same time, and that causes the symptoms on the inside part of your elbow. And also you'll have some numbness and some swelling in that area. So this is really common with construction workers and the assembly line workers, like I said before. So, as occupational therapist, if I have somebody who comes in with a prescription and they have one of these diagnoses, I'm going to go ahead and do an evaluation, but my main thing in the beginning is going to be pain control. So I'm going to use some modalities to try to get the pain under control and get the swelling down. Before we start doing any exercises or strengthening, we have to get that pain under control. So we're going to use ice packs, an ultrasound, which is a deep heat that goes deeper into the muscle than just a regular hot pack would. We can stimulate the muscle with electrical stimulation. Fluidotherapy is like a dry whirlpool that warms the hand, helps increase blood flow, and encourages healing. And then, of course, the TENS unit, which helps block the pain signal so we can better tolerate everyday activities or our sleeping cycles. So after we get the pain under control, then we're going to instruct you in some special exercises. Now, a lot of people can just say, well, I'll just move my hand like this, it's going to get better. But it's important to know which exercises to do so that you can move safely and let everything heal. Because some exercises are actually going to put more stress on that area and actually cause more problems rather than helping you heal. Then we're going to educate you on how to prevent this from happening again. So what should I do at my job so that I don't have this condition again? And also, we do a lot of splinting. We have prefab splints that we order, or we can make a custom splint that will fit specifically your hand so that it allows wherever your pain is or whatever your condition is to rest. And a lot of times that's just what it needs, is rest. Even rest from using it in everyday activity. So we'll splint it and immobilize it for a while and just allow everything to heal. And then we're going to go into the education and teach you what to do to prevent it from happening again. Ergonomics. Basically, ergonomics means the study of people at work. So when we're looking at ergonomics, everybody's going to be different. People have different body types. Their jobs are different. Their workstations are different. So we really have to look at each person in their own element and make sure that we're directing the ergonomics that's going to be specific to them. So we're going to look at the equipment they use on their job. We're going to look at their keyboards, cell phones, computer monitors, their chair, their desk, the procedures that they have to go through every day to complete their job. And then also there's things physically in the environment that can cause you to have to strain yourself or move in an awkward position because of poor lighting or because the noise level is too high or too low and you can't hear or see what you're supposed to be doing, so you're going to be moving your body in different positions that might put it at risk for injury. One thing I really want to talk about, since computers are pretty much a part of everybody's life these days, I specifically wanted to talk about workstations and computers. Whenever you're sitting at your desk, your monitor should be 18 to 24 inches from your face, okay? So you don't want it to be too close, but you don't want it to be too far away where you're having to squint. So you're going to adjust your chair to where the top of the screen is right at your eyes. You're going to make sure your head's up and your ears are even with your shoulders, so you're not slumping or causing a lot of strain on your neck or your back. Secondly, we're going to look at your keyboard. You want to make sure that it's flat or slightly tilted. If your keyboard's setting up too high and you're having to bring your wrist back or extended for long periods of time, then you're going to start getting pressure on that median nerve inside your carpal tunnel. So we have these wrist rests that go on our computer, and a lot of people use them while they're typing, but actually these are supposed to be used only for rest breaks, because if you have your hand resting on the wrist rest while you're trying to type, your wrist is going to be in too much extension, and that's actually going to cause you more trouble. So when you're looking over, you're trying to take a break, let your wrist rest on that, and then when you're ready to type again, make sure that your wrists are straight and not bent up or down, and that'll put less pressure on the structures that run through the wrist. Try not to stretch your fingers out to reach keys. Move your whole arm and hand. That way you're not aggravating all the small muscles and your fingers are using the bigger muscles to move. Keep your fingers curved instead of keeping them straight or extended out. That's going to put a lot more pressure on your fingers as well. And obviously the amount of pressure you put on the keys is going to put extra pressure on your joints if you're pushing them too hard. We want to keep our hands at waist level, straight in front of us, not too high, not too low. Bending too much at the elbow is going to put pressure on our elbow structures and cause some numbness and tingling and problems with that over time. Your shoulders should be relaxed, and your elbows should be at 90 degrees. And the same should apply when you're using your mouse. So if your chair elevation is right, like we talked about before, then your monitor should be right at eye level. But when you're typing, don't use your armrest to put your elbows on. If you're using your armrest, then your elbows are going to have to be bent too much, and that's going to put extra pressure on your elbow structures. Ways to make ergonomics work for you. These are things you can do on a daily basis to help prevent some of these injuries, but also to keep you from having pain not only in your hands, but also in your back and your legs and different parts of the body that are stressed every day whenever you're doing your work. The number one thing, people try to work too fast, and I know sometimes you're low-staffed and you have to do that, but it's best to try to pace yourself, because a steady pace can actually help you get the job done better in the long run. Take mini breaks to allow your body to recover. You know, it's recommended every hour if you're sitting to get up and do some stretches for at least 1 minute. And that way that allows your body to recover from sitting in one position too long. And that way that'll prevent some injuries in the future. So when you're up for that 1 minute, take time to stretch. It'll help renew and strengthen your muscles, and it'll also help you focus better when you come back. So 1 minute every hour is not too much to ask, but you just have to remember to do it. Vary in your posture. If you're sitting in a chair a lot, make sure you're doing weight shifts, not sitting in the same position for a long time. And the last one is vary your routine. So if you have more than one thing to do, try not to sit at your desk too long and do all your typing at one time. Try to even everything out. Do some typing, then go file some charts, go do some copies you need, and then come back to the typing. That way you're changing your task and you're not putting repeated stress on the same muscle groups over and over again. If you have problems and you're not sure if your workstation is ergonomically correct and you want an occupational therapist to come out and assess your workstation, or if you're already having some symptoms of some of the disorders that we talked about, you can always ask your physician for an occupational therapy order, and he can send you over to lift therapy and we can assess everything. We can even come out to your workplace and look specifically at your workstation and make recommendations for you, because we want to prevent these things from happening, and it's better to be proactive before the symptoms start and be preventative than have to treat them after they've started. So as occupational therapists, we want our patients to function at their maximum level in all facets of their life. So this is a joke that we have had on our board forever. We go in and teach patients after they've had a stroke or some kind of injury how to dress themselves again, how to save energy. But when we get up in the morning, we have to know that we have to put our pants on first and then your shoes, because it doesn't work otherwise. So, do you have any questions for me? No? No questions? All right. Well, thank you for coming.